Hi, I'm Sian, one of the news editors at Manx Radio, and a member of the Health Services Consultative Committee has submitted her resignation, stating that she can no longer work alongside the current Health Minister, Lawrie Hooper. Annette Baker, who's currently the vice chair of the body, says that there is a toxic and adversarial atmosphere created by the current minister. It comes following a row between the committee and the Health Minister over the contents of its annual report. I asked Mrs Baker more about her decision to step down.
It's come at the end of a very difficult year and a very sort of unfortunate set of circumstances. I mean, frankly, Sian, I'm just exhausted and stressed out, really, even in my retirement now. I retired to escape from this kind of pressure, but I feel that the last 12 months in particular have really been too much in terms of what this voluntary role has taken out of me. I expected it to be demanding, and I expected it to call for, complete professionalism and a lot of work, which it was. But I wasn't expecting the kind of treatment that we've received, frankly, at the hands of the minister and some of his colleagues.
Now, you've described in your letter the treatment from the minister as toxic and adversarial. What specific issues did you encounter with the minister?
Well, what happened was the HSCC, and can I make it clear at this point that I'm speaking as Annette Baker individual, not as a member of the HSCC now. I am the vice chair until the resignation kicks in at the end of January. But these comments are purely post-resignation and purely from me as an individual. What led to this? The HSCC writes an annual report, which is submitted to the department, to the CEO of the Department of Health and Social Care, and then to the Minister and to members of Tynwald. In my experience in the 3 years I've been on the committee, this arrangement had worked pretty well. We worked really, really hard on this report. We had access to governance meetings. As lay people, we did our very best to interpret the information that we accumulated from those meetings and spent a long time compiling a report on specific areas which we were all responsible for. In my previous experience, up until this year, that had worked pretty well. The report was submitted to the CEO of DHSC, and a formal response was given at a feedback meeting from the minister. And the previous minister handled this really well, I thought. He didn't necessarily agree with everything that we said, but he discussed the issues that we raised in a professional and courteous manner and provided clarification where he felt this was due. This didn't happen with the minister this year. The minister took exception, in my view, to the report and kicked back in a most extraordinary way at the feedback meeting in June, and in fact behaved entirely inappropriately along with his colleague who was present at the meeting, and upset an awful lot of hard-working, earnest, honest, upright public servants who were trying to do their best to do the job that they've been given to do as volunteers. Let's remember here that people have volunteered for this. It's not some kind of highly paid job, which has all that comes with that. People volunteered to do this, mainly like me, to hopefully make a positive difference in the area of health. So that happened, and then subsequently, whenever the opportunity has arisen, and most worryingly in Tynwald at the end of October, the minister has called into question the professionalism of all of us who were involved in writing that report, and has basically continued to upset us all and to create an atmosphere that I no longer want to work in.
So following the publication of the report, there have been some changes to the remit of the committee. What do you think of those changes?
We always knew there were likely to be some changes to the regulations, which we understood would be undertaken following an appropriate period of consultation. And we were given to understand that at the start of the year. What actually happened, to sort of cut a very long story short, in my view, is that the minister was annoyed at our report, and as a knee-jerk reaction, he changed the regulations without due consultation. Shortly after the feedback meeting in June, there was a press release from the department which more or less detailed the changes that were supposed to be consulted on. And that really took the rug from under the feet of any kind of consultation. made any kind of meaningful consultation actually irrelevant, because it was clear what he was intending to do. And, subsequently, these were challenged, and they were challenged most recently in the House of Keys and in Tynwald, in fact, and were very nearly overturned. And but for the intervention of the unelected MLC Legislative Council, they would have been overturned, and there would have been hopefully a proper consultation. Remains to be seen what happens with that. I do hope that further steps are taken to go back to those regulations, which effectively remove the independence of the scrutiny committee. They basically make the committee directly appointable by the Department of Health and Social Care, and they make any report written, make it that report should be submitted to the Department of Health and Social Care for so-called fact-checking, and we all know where that can go. Frankly, removing the independence of the committee and subjecting any work that it completes to this kind of, well, to my mind, political interference, again, isn't something which I was comfortable or happy with, and it played a major part in my decision to resign.
You mentioned there political interference. You state in your letter it doesn't bode well for democracy. You talk about the democracy aspect in your letter. What would be your message to the Minister and to the department in general about the impact that this has?
Well, it's left a very sour taste in all of our mouths. All of the people who are involved in the writing of the report, the very hard-working, dedicated people on the HSCC. My message to the Minister really would be to come back round the table with us to talk about the findings of the report and any issues he had with it in a professional way, as previously happened. There are some points in there which we still feel, and many points which are worthy of serious consideration by the DHSC, and we feel now that there's been absolutely no due process of reviewing our recommendations or any of the feedback that we provided, which is a real shame, because the whole intention of our report was to try to help to make things better. So I would urge him to talk to whatever the incarnation of the HSCC is in future about last year's findings, about any and also about any subsequent findings that the committee has, basically to explain any objection he has to it in a professional manner, which I don't feel happened this year. I think he got annoyed and he reacted badly, and I think that's been fundamental to his subsequent conduct since, and he's found it very difficult to step down from that stance and to come down and talk to us sensibly, which is all that any of us ever wanted.
And do you worry about the impact this has on anyone who might be thinking of putting their name into the hat for a role like this?
Absolutely. But if you look at the new regulations that have ostensibly gone through at the moment, in my view, they are extremely onerous on the chair people and anybody in leadership positions on the HSCC who would want to do that role for the very small stipendium that you get for it, which is under £1,000 to cover expenses. You know, if I'm to be quite honest, I don't think there's any sort of secret surrounding how little is remuneration for this role. So nobody would want to do it for the money that's being paid. Not that any of us thought of that when we entered into this, because we volunteered essentially for the role and were happy to accept whatever was given in the form of remuneration for expenses. So this is the most worrying thing, because why would anybody put themselves through what we've been through? You know, we've been subjected more or less to 6 months now of confrontation with the Minister, who's taken every opportunity to disparage our work, accusing of us of inaccuracies in our reporting and even lies. I mean, how he can possibly say that, knowing actually that right up until this point, none of us have been able to come back with any answer, because we're obliged by our terms and conditions of employment not to publicly pronounce on anything. You know, why would anybody put themselves through that and risk being treated in the way that we have been treated over trying to do a good job? All we were trying to do was do our very best to try and report on what we saw. As lay people, we haven't got medical expertise, but we had access to governance meetings, and to the best of our ability with the available information, we reported on those. And we were treated in an entirely inappropriate way, as I've detailed in my letter, and have continued to be. It's been made into something personal when it never was. It was all about trying to improve public service on the Isle of Man, which is all any of us ever wanted. And it annoys me intensely that it's been made into something different, and crucially, that attention has been distracted from the job at hand, which is improving the health services, which we all know and need to, there are issues that need to be addressed, and urgently so. Incidentally, could I please say, and I said this in my letter, that my issues are with the Minister and with his team, not specifically with the officers of the DHSC nor of Manx Care. There are some excellent professionals working on the island, and it's been an absolute privilege to work with them, and they are conducting themselves entirely professionally and working extremely hard in very difficult circumstances, and I want to pay tribute to them.
Thank you for making it to the end of the Little Manx Radio Newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.